Welcome to our Dentist by One guidance. I'd like to talk to you about encouraging families to bring their children to you for an initial exam at the sign of their first tooth or by their first birthday. During this presentation, I'll discuss how this idea benefits your patients, but how it also benefits your practice. I'll also go over ideas to help develop and prepare your team for these visits, including some tips for success. Later, a video of an actual knee-to-knee exam for you to watch will be shown if you are unfamiliar with the concept. I've also provided examples of anticipatory guidance topics that are worth sharing with your families. As we know, and as stated by the AAPD, the ADA, and the AAP, children should be seen by age 1 in the dental office. Children that have an age 1 preventive visit are more likely to have subsequent visits. Dentist by One visits are good for your patients. Children who begin dental exams early and continue them consistently can have better oral health outcomes. Problems can be discovered and intervention can happen before they become too great. It is a convenience for your families to have the dental care of each family member provided to them, all under the same roof, no matter their age. You have the trust of your patients and can therefore empower them to be an active part in the health of their children. A positive first dental visit that you create can influence a good lifelong attitude towards dentistry. These early visits can greatly benefit your practice also. By having early starters in your practice by age 1, you have a potential patient for 18 years or more. Your practice grows by seeing generation after generation of patients. There are financial gains for your practice as well. When coding and billing for D0145, you will be reimbursed for an exam for children 3 years of age, anticipatory guidance, and D1206 fluoride varnish. If you are ABCD certified, you are eligible for enhanced Medicaid reimbursement. When implementing Dentist by One into your practice, a team effort is necessary. Your entire team must be made aware of the fact that you are seeing children at age 1. If you have team members that excel at working with young children, tap into those skills. Hygienists and assistants can identify potential early starters when working with parents and caregivers and recommend they make an appointment for those children before they leave. The front office can also take note of any infants and young children in the waiting area and approach the family or caregivers to explain the importance of the age 1 dental visit. This is also a great time to hand out a brochure on the subject. The demographics of your practice are, of course, your choosing. So if you prefer not to see these early starters, please refer them to a Dentist by One office for their early years. Let's talk tips. Let the parent or caregiver know what is about to happen so you can enlist their help. Stay engaged with the parent to help keep them calm, which will in turn help keep the child calm. Scheduling morning appointments when children are more cooperative might be helpful. Meal times or nap times could be problematic and should be avoided. Have everything you will need opened, laid out within easy reach, and ready to go. Quick is good. And remember, very young children are quite possibly going to cry, so make the most of that open mouth. This is a snapshot of a knee-to-knee exam and how it looks. Let's watch a video of an exam in action. Notice the provider has all the necessary supplies ready and handy. Here, the provider is explaining to mom what is going to happen. The provider then gives directions on how to position her child for the knee-to-knee exam. Reassure mom that it's okay if they cry, because remember, their mouth is open. Notice that from mom's vantage point, she has a great view of what her child's mouth actually looks like. Also note that the provider keeps mom engaged by explaining what she is doing, what she sees, all the while offering anticipatory guidance. One last thing I want you to be aware of. This is an unscripted, unrehearsed knee-to-knee with a 1-year-old, and it was all done in 3 minutes. Topics that are worthwhile visiting with parents about are limitless. It's helpful to utilize a risk assessment tool to determine which behaviors need addressing, as well as acknowledging behaviors that should be applauded. Don't assume something that is common knowledge to us as dental providers is common knowledge to others. Share what you know. Examples of discussion points are the dangers of sharing germs, lifting the lip, using a dab of toothpaste the size of a grain of rice, beginning at the eruption of the first tooth. Home care does not have to happen in a bathroom. Inappropriate use of bottles and sippy cups. Alleviating pain from teething. The benefits of fluoride in tap water, and many others. Use what you see in the mouth and what you hear from the caregiver to guide you in what you choose to discuss. I hope this presentation has given you many reasons to implement Dentist by One visits in your office. These resources are available to you to help in any way. Thank you for your time.